In this section, we will take a closer look at key indicators from Section 3 of the RACGP Standards for general practice. This section has two standards, including safety and quality and education and training. Remember, some of the indicators have a triangle, which means that those indicators are required, and those don't have a triangle, which means that they're recommended but not essential in order to gain a successful accredited status. The key criterion and indicators worth a special mention as part of this section include Criterion 3.1.1, quality improvement activities. Now, as part of this indicator, you may need to describe aspects that your practice has improved over the past 3 years. Criterion 3.1.2, clinical risk management systems. With this indicator, surveyors will want to see that you regularly monitor and identify and report near misses and mistakes in clinical care. You must keep a record of these events so that they may be discussed and addressed with practice staff in order to prevent reoccurrence or any adverse outcomes. A near miss is usually an event which could have resulted in a serious adverse outcome, but that luckily didn't escalate to that point. So examples could be pathology request scripts or referrals that are written for the wrong patient, if perhaps there are 2 patients with similar names in the database, or a sharp being left unattended, but where no sharp injury actually took place, or even a frustrated patient escalating to the point of potential aggression or verbal abuse. Now, the practice should also put in place a contingency plan for adverse and unexpected events such as natural disasters, pandemic diseases, or the sudden unexpected absence of clinical staff. There are templates available to assist with this as part of the resources guide. Criterion 3.1.4, patient identification. It is important that the practice uses a patient identification process of 3 approved patient identifiers, and that the practice team can describe how this is applied when making appointments, writing prescriptions, writing referrals to other providers, or giving results or entering results or correspondence into records. The most common and least obtrusive identifiers are usually patient name, date of birth, and address. Criterion 3.2.1, qualifications of general practitioners. You will be required to provide evidence of appropriate current medical registration for your GPs. All recognized GPs, you will also need to produce a VR status confirmation letter, which can be obtained from Medicare. You must also collect evidence of satisfactory participation in the RACGP QI CPD program, so that's their CPD points, for all your GPs. You also need to show evidence that they've completed their CPR, at least in the last 3 years. Criterion 3.2.2, qualifications of clinical staff other than medical practitioners. You must also make sure nurses and allied health professionals have current registration and that they're working within their scope of practice and that they're participating in continual professional development, or CPD. They must also have undertaken training in CPR within the previous 3 years. Criterion 3.2.3, training of administrative staff. Now, for practice staff, you must have evidence of training relevant to their role in the practice. Again, the staff training sheets are a great resource for this. Admin staff must also have CPR training at least every 3 years. In the next video, we'll discuss in more detail key standards from Section 4, practice management.